Hello everyone. Today we will talk about the menopause and the physiology and pathology of the perimenopausal period and menopausal transition. Also, at the present lecture, I'd like to make a little journey to a world of art, and I choose and select the paintings of the famous artist on which the women of advanced age are depicted. And this is the very famous picture of Whistler, and the name of this painting is Whistler's Mothers. So let's start and talk about the menopause. Menopause is one of the most significant events in a woman's life and brings in a number of physiological changes that affect the life of a woman permanently. There have been a lot of speculations about the symptoms that appear before, during, and after the onset of menopause, and these symptoms constitute the perimenopausal syndrome, and they are impairing to a great extent to the woman, and management of these symptoms has become an important field of research. Uh, and this lecture attempts to understand all these symptoms, the underlying pathophysiology, and the management options of these pathological changes that take place in the menopausal period. And once more, menopause or climacteric is derived from the Greek word climacteric, that means level or step. It's a physiological period of the woman's life followed by involuntary processes in the genitals which result in sequential cessation of reproductive and menstrual function. Menopause is the permanent cessation of menstruation and resulting in the loss of ovarian follicle development. And the age of menopause appears to be genetically determined and is unaffected by race, socioeconomic status, age at menarche, or a number of prior ovulations. Factors that are toxic to the ovary often result in an earlier age of perimenopause. For example, women who smoke, they experience an earlier menopause. And women who have had surgery on their ovaries or had an hysterectomy despite retention of their ovaries may also experience early menopause. And this is the painting of famous Gustav Klimt, Woman in Armchair. And by stroke criteria, menopause divides into stages. First of this, it's a menopausal transition, and it's accounted for the age 40, 45 years, menopause, perimenopause, and postmenopause. Objective. Let's have a look to the statistic numbers. 49% of world population are women. 10% of them are in perimenopausal period. 5% of them have preterm menopause. 25 million women annually step into menopause, and to 2020 this number reached 47 million. To 2030, number of women older than 50 will reach 1.2 billion. Although menopause is associated with changes in the hypothalamic and pituitary hormones that regulate the menstrual cycle, menopause is not a central event, but rather a primary ovarian failure. At the level of the ovary, there is a depletion of ovarian follicles. The ovary, therefore, is no longer able to respond to the pituitary hormone. It's a follicle stimulating hormone and luteinized hormone, and this leads to the decreasing or cessation of the estrogen and progesterone secretion by the ovaries. Androgen production from the ovary continues beyond the menopausal transition because of sparing of the stromal compartment. Menopausal women continue to have low levels of circulating estrogens, principally from peripheral aromatization of ovarian and adrenal androgen, especially in obese women. And also menopausal women, they have high levels of follicle stimulating hormones, and this level rise in response to ovarian failure and the absence of negative feedback from the ovary. And when does menopause occur? The onset of menopause coincides with the end of the last menstrual period, and that's why menopause is a retrospective diagnosis and can be only made after 12 months of amenorrhea. Menopause is a natural and irreversible process and occurs in women of the Caucasian race at about 51 years of age with various ethnic and social variations. If menopause occurs before the age 40, then it's regarded as early menopause. And it's the most possible cause for this is the premature ovarian failure and is defined as the menopause the age of 40 years. It may be idiopathic or associated with toxic exposure, chromosomal abnormality, or autoimmune disorder. Also, the one of the most common causes for the premature menopause is the surgical operation by the removal of ovaries or ovariectomy. Which stages are there in menopause? It's a premenopause, and during the premenopause, the normal reproductive life is evident, and the premenopause it lasts till the age 35. After that, perimenopause, and it lasts from the age 45 till 51 and lasts till the last menstrual period. And after that, menopause and postmenopause. These are the main stages of menopause. And what are the climacteric and what the climacteric syndrome is? Climacteric syndrome is the complex of different symptoms that usually develops as a result of hormonal changes in the female organism during the menopause, and climacteric syndrome is consists of the combination of next symptoms like hot flashes, increasing sweating, tachycardia, increased blood pressure, dizziness, insomnia, cognitive impairment, mood swelling, dry skin and mucosa, fatigue, increased appetite, suffocation. And these are the main symptoms that women experience at the presence of climacteric syndrome. And depending on the severity and the combination of these symptoms, there are 3 degrees of climacteric syndrome. It's a mild, moderate, and severe the types of climacteric syndrome. Menopausal transition or perimenopause is a period of time beginning with the onset of irregular menstrual cycles until the last menstrual period and is marked by fluctuation in the reproductive hormones. And during this period, um, uh, uh, irregularities of menstrual cycle develops and they become more prolonged and heavy menstruation intermixed with episodes of amenorrhea, decreased fertility, vasomotor symptoms, and insomnia. Some of these symptoms may emerge 4 years before the menses cases. And during the menopausal transition, estrogen level decline and the level of follicle stimulating hormone and luteinized hormone increases. And the menopausal transition is characterized by variable cycle length and missed menses, whereas the postmenopausal period is marked by amenorrhea. The menopausal transition begins with the variability in the menstrual cycle length, accompanied by rising follicle-stimulating hormone levels, and ends with the final menstrual period. And starting with this period, the symptoms of the climacteric syndrome may develop. And the main contributors to the developing of this syndrome is the decreasing function or cessation of the function of the ovaries. Mark Chagall, strawberries. And what are the general pathologies of the perimenopausal period? First of all, it's a cardiovascular disorders. Why? Because during the reproductive age, ovaries produced estrogens, and this estrogen, they have very, very important function, and it's a cardio and vascular protective function. And that's why the incidence of the cardiovascular disorders in young women is very low, but after age 60, when the woman is already several years in postmenopausal period, the incidence of cardiovascular disorders in women almost equal to the same rates in men. Osteoporosis, also due to decreased level of estrogen, demineralization of the bones and decreasing of their density develops, and it's lead to the osteoporosis. Urogenital impairments, they are one of the most common symptoms of early and late postmenopausal period. Sexual violations, obesity and metabolic disorders. A lot of women experience obesity and metabolic disorders. Tumors. And this is the painting of famous Azerbaijan artist Tahir Salahov, Tribute to Mothers. Let's have a look to the prevalence of menopausal symptoms. Usually, about 51.6% of women, they experience vasomotor symptoms. And climacteric syndrome, it's also one of the vasomotor symptoms. 35.2% of women, they experience psychosocial problems. A lot of women, they experience cognitive disorders and also psychological problems such as depressions and anxiety. 44.5% of women experience physical problems. 25.8% of women experience sexual problems, and about 44.5% of women other symptoms of perimenopausal period. Perimenopause usually characterizes with the transitory hyperestrogenia and anovulation. Also, symptoms of estrogen deficiency. And transitory hyperestrogenia and anovulation, they are characterized by the mastodynia. What is this mastodynia? Mastodynia, it's a pain in the breast, and breasts are become very gorgeous, sensitive, and followed by the feeling of tenderness and the pain, menorrhagia, and migraine and nausea. Menorrhagia develops as a result of anovulatory cycles, and usually also some women during the perimenopause, they experience the development of the myomas, and depending on the location of these myomas, incidence of mena or metrorrhagia also increases. And migraine, nausea, Symptoms of estrogen deficiency, they divide into the vasomotor symptoms or climacteric syndrome, psychological problems, and urogenital disorders. Also due to decreased level of estrogen, the atrophic and involutionary processes in the female genitalia start to develop, and also decreasing of the amount of estrogen receptors in the urogenital tract. It will lead to the development of the urogenital problems. Postmenopause. Postmenopause characterized by the early and late symptoms. Early symptoms, these are vasomotor symptoms, psychological problems, general physical, urogenital, and sexual violations, and to the late symptoms. And late symptoms usually are metabolic problems and obesity, cardiovascular disorders, usually it's arterial hypertonia, and also ischemic disorder of the heart, musculoskeletal problems and problems with joints, and urogenital problems. Early symptoms. Mostly these are vasomotor symptoms, and usually vasomotor symptoms affect up to 75% of perimenopausal women. Usually symptoms last for 1-2 years after menopause in most women, but may continue for up to 10 years or longer in others. Hot flushes are the primary reason women seek care in menopause. Hot flushes not only disturb women at work and interrupt daily activities, they also disrupt sleep, and insomnia develops, and also it affects the psychological condition of a woman and affects the quality of life. So they experience emotional lability, fatigue, depression, mood swelling, irritability, anxiety, hypertension or hypertensive disorders, frequent night awakening, night sweating, joints and back pain, increased body mass and disproportion, sexual violations, and hot flushes. The physiological mechanism underlying hot flushes are incompletely understood. A central event probably initiated in the hypothalamus drives an increased core body temperature, metabolic rate, and skin temperature, and this reaction results in peripheral vasodilatation and sweating in some women. The central event may be triggered by noradrenergic, serotoninergic, and dopaminergic activation. Although an luteinized hormone surge often occurs at the time of the hot flushes, and it's not causative because vasomotor symptoms also occur in women who had their pituitary glands removed. And exactly what role estrogen plays in modulating of these events is also unknown, and the vasomotor symptoms are a consequence of estrogen withdrawal and not only the estrogen deficiency. Carol Heuser, Old Lady in a Fur Hat. What about the late symptoms? These are mostly metabolic disorders, cardiovascular disorders, osteoporosis, musculoskeletal pathology, urogenital disorders, and atrophic vulvovaginitis. Quentin which? Cardiovascular pathology and the menopause. Incidence of cardiovascular pathology in menopause increases for 4-fold times. In 40%, it terminates with death. At 60 years, incidence of arterial hypertension reaches 80%. Diabetes mellitus, smoking, and hyperlipidemia increase incidence of cardiovascular disorders. Early menopause, it's menopause that occurs at age 40-45 years, increases this incidence to 40 to 65%. As earlier menopause starts, the incidence of cardiovascular disease increase proportionally. This is the pathway of cardiovascular problems that develops at menopause. Central role belongs to estrogen deficiency and progesterone deficiency. Estrogen deficiency leads to the relative hyperestrogenemia. Relative hyperestrogenemia will lead to the decreasing of level of sexual hormone binding globulin and increasing of visceral fat. Also, at the meantime, endothelial dysfunction develops, and this endothelial dysfunction leads to the intravascular inflammation. Increasing of the amount of visceral fat will lead to the insulin resistance. Also, increased amount of circulating androgens, free androgens, will lead to the increasing of insulin resistance and to dyslipidemia and developing of metabolic syndrome. And as we know, metabolic syndrome consists of 4 main symptoms. These are dyslipidemia, elevated blood pressure, collection of visceral fat, and insulin resistance. And all these factors will lead to the elevated blood pressure and cardiometabolic changes. And the second pathway is the progesterone deficiency, and deficiency of the progesterone will lead to the decreasing of the amount of nitric oxide that is the one of the main vasodilators of the organism, and decrease to the incidence of vasodilatation and increasing of vasoconstriction due to increased level and secretion of angiotensin. And angiotensin increased the levels of aldosterone secretion, and again it will lead to the elevated blood pressure and cardiometabolic changes. This is the main pathway of developing of arterial hypertension and cardiometabolic changes in postmenopause. Incidence of cardiovascular disease and relation to menopause state. And let's have a look to this table, and we will see that with the age, the incidence of cardiometabolic changes also increases, and we see maximal changes at the age 50, 54, and in postmenopausal woman, it's accounted for 6.5 per 1,000 women, and in premenopausal woman, it's accounted for 3.6 per 1,000 women. Main mortality causes in menopause are cardiovascular disorders, and usually at the age between 50 to 60, the incidence of cardiovascular disorder mortality from the cardiovascular disorders is the maximal, and incidence it's about 50%, about 15 to 18% is the cause of the mortality in postmenopause. It's different types of malignant tumors, about 5 to 10%. It's a breast cancer and accidents. Osteoporosis. Each one of 3 women and of 5 men over 55 years are suffering from osteoporosis. Every second woman aged 50 and over has an osteoporotic fracture during her lifetime. Osteoporosis as a cause of disability and mortality of patients from bone fracture ranks 4th among the non-infectious disease. Vincent van Gogh, Old Woman with Stuff. What is the treatment of osteoporosis at menopause? It's a calcium and vitamin D. Medicines decreasing bone resorption, medicine increasing bone construction, and these are fluorides, anabolic steroids, androgens, growth hormone, and also multi-planning action medicines. Paul Cézanne, Five Bathing Women. One of the most common pathologies during the menopause is obesity and metabolic syndrome. Rapid weight gain, more than 2.3 kilograms after 3 years of menopause, is experienced by the 60.7% of women. More than 4.5 kilograms is accounted in the 20% of women, and more than 5.5 kilograms after 8 years of menopause is experienced more than 80% of women. Abdominal android or upper type of obesity. The fat distribution changes and a lot of fat tissue collects in the upper body area on the shoulders, back, neck, and the breast. And it looks like the android type of obesity. Excessive deposition of adipose tissue in the abdomen and upper body, and apple body type, something like this in this picture. And the author of this picture is Lucien Freud, Sleeping Woman. Sexual violations. It's one of the most common symptoms that women experience at menopause. And the central role plays decrease in the levels of estrogens and androgens, and it will lead to the decreased self-esteem and feeling of insecurity, decreased sexual sense and libido, dryness of the vagina and dyspareunia, and all this will lead to the problems with cognitive impairment and the problems with in central nervous system. What are the factors that affect sexuality? First of all, it's a personal relationship. These are relationship with a partner, psychosocial factors, lifestyle and habits, health problem, presence of different chronic disorders. Fernando Botero spouse. And this slide presents the frequency of sexual intercourse during the month in premenopausal, menopausal, and postmenopausal women. And as we can see, about 20% of menopausal women have the sexual intercourse once during a month. 40% of women, 40 to 50% of women menopausal, they have sexual intercourse 2 or 5 times per month, and about 25-28% of menopausal women have sexual intercourse 6 to 10 times per month, and this demonstrates the decreasing sexual sense and sexual libido during the menopausal period. And in all three groups, the maximal quantity of sexual contacts, number of sexual contacts during the month, it's from 2 to 5. What is the treatment option for the symptoms of menopause? It's a menopausal hormonal therapy, and it remains as the main question Yes or no to the menopausal hormonal therapy. Systemic estrogen therapy is considered one of the most effective treatments available for vasomotor symptoms and the associated sleep disturbance. Healthy women in the perimenopausal transition who are experiencing bothersome hot flashes but still menstruating may benefit from oral contraceptives. And very low dose estrogen therapy also effectively treats hot flashes for many women. Low dose oral estrogens or transdermal estradiol often is effective and is associated with minimal side effects and endometrial stimulation. But in some cases, some authors or some facts, they try to prove that the menopausal hormonal therapy, along with the benefits, also have the side effects such as hyperstimulation and proliferation of the endometrium with the developing of the endometrial hyperplasia and even to endometrial atypical hyperplasia or endometrial cancer. Also, they have negative effect to the breast, especially those women who have the hereditary breast cancer problems. And that's why menopausal hormonal therapy is still remains the one of the most arguable questions of the modern gynecology. The goal of menopausal hormonal therapy serves to fulfill the hormonal function of the ovaries in women experiencing a deficiency of sex hormones. The task of menopausal hormonal therapy to improve overall condition with the lowest dose regimen, to establish prevention of late metabolic changes, and to avoid complications. And the patient's age and years elapsed since the onset of menopause affect the regimen recommended. And we recommend to the woman at the age 40-45 years combined oral contraceptive in low dose with estradiol valeriate, progestin only during 10 to 14 days of the cycle. Women in perimenopause, we recommend continuous sequential hormonal replacement therapy, recent menopause, cyclical combined hormonal replacement therapy, and women who experience more than 2 years of menopause, continuous combined hormonal replacement therapy. The age does not seem to influence the choice of route of administration, but we don't recommend hormonal replacement therapy to women who are at menopause for about 10 years. What are the indications for the hormonal replacement therapy? Vasomotor symptoms, as I told you, menopausal replacement therapy has very high positive effect on the treatment of vasomotor symptoms, sexual dysfunction, and urogenital disorders, and usually we recommend administration of the estrogen containing creams intravaginally, and it's really improved the quality of the vaginal mucosa and affect the sexual life and improving it. Prevention and treatment of osteoporosis, poor life quality related to climacteric, premature and early menopause, and ovariectomy. Salvador Dali, Galatea. Menopausal replacement therapy requires individual approach. Please remember that. A differential approach taking into account the woman's health and the presence of chronic disease. And the main factors that are considered at the prescribing the menopausal replacement therapy are age of woman and duration of menopause, features of menstrual function in reproductive period, early menopause. Mark Chagall, Bella in green. What are the contraindications for a menopausal replacement therapy? These are mostly vaginal bleeding of unknown causes. It may be vaginal bleeding due to cervical pathology and including cervical cancer or hyperplastic processes of the endometrium. It may be a complex hyperplasia with or without atypia, and sometimes it's even maybe the endometrial cancer and submucous myomas. Severe liver disease is almost contraindication for hormonal therapy. Deep venous thrombosis because administration of estrogens increases the incidence of thrombosis, especially on those women who are smoking. Acute thromboembolic conditions, breast and genital cancer, depending on localization and conducted therapy. Pablo Picasso, Woman is Crying. Optimal time for beginning of menopausal replacement therapy and dosage. And it depends on the period of life, age, and usually we prescribe menopausal replacement therapy during the menopausal transition and the early menopause that lasts for 5 to 8 years. And if it's menopause lasts more than 8 years, we don't prescribe any menopausal replacement therapy. Age of woman should be less than 59 years. And the dosage, it's a minimal effective dose. This is the optimal time and the optimal dosage for the menopausal replacement therapy at menopause. And here you can see the types of estrogens that we usually prescribe during the part of menopausal replacement therapy, and usually these are exogenous estrogens and synthetic estrogens like ethinyl estradiol, estradiol valerate, and mestranol. Also 17 beta estradiol. Usually these are main hormone estrogens that we prescribe at menopausal replacement therapy. Here you can see the types of estrogen replacement therapy, and this replacement therapy is categorized according to its various routes and administration. We can prescribe oral estrogens as the pills or tablets, vaginal administration of the creams, pessaries, and rings containing estrogens, and also transdermal implants like implants, patches, sprays, or gels. And we make the administration of these medicines over the skin or implant inside the skin, and they release a low dose of estrogen regularly during some period of time, depending on the type of this transdermal estrogen. What are the benefits of menopausal replacement therapy? It's a increasing of the quality of female life and the decreasing of the vasomotor symptoms. It's also decrease the incidence of depression and give the very good therapeutic effect. Urogenital disorders, sexual dysfunction, postmenopausal osteoporosis, skin and its derivatives, metabolic syndrome, cognitive impairment, cervical cancer, colorectal cancer, cancer of esophagus. All these pathological processes, they get the benefits from the treatment with menopausal estrogens. Negative effects, it's breast cancer, increasing incidence of breast cancer. However, there are a lot of randomized clinical studies that prove that there is no high association of the developing of breast cancer with the menopausal hormonal therapy. But anyway, women who get menopausal replacement therapy are at a little bit greater risk for the developing of breast cancer. Also, endometrial cancer, ovarian cancer, thromboembolic pathologies, stroke. Francisco Goya, your time is up. Along with the menopausal hormonal therapy, replacement therapy, we have the additional methods of treatment of menopausal syndromes, such as homeopathy, phytoestrogens, phytohormones, antihypertensive drugs, statins, fenfibrate, biphosphonate, calcitonin, antidepressants, metformin, calcium and magnesium ions, vitamin D, and antioxidants. And depending on the type of phytoestrogens, there are some benefits and adverse side effects. For example, for isoflavones, mostly soy isoflavones were studied, and we recommend the medicines that containing soy isoflavones for those women for whom menopausal replacement therapy is contraindicated. And the benefits of isoflavones, they reduce the risk of postmenopausal cardiovascular disorders, osteoporosis, and cognitive decline. They also reduce risk of breast cancer, endometrial cancer, and ovarian cancer, and reduce frequency of hot flashes. Adverse side effects, non-reported. However, soy has been identified as one of the 8 major food allergens in the US. Lignans, they also reduce risk of postmenopausal cardiovascular disease and reduce risk of breast cancer among postmenopausal women. And adverse effects, usually non-reported. Some study participants experience glucose disturbances. Resveratrol reduces risk of postmenopausal cognitive decline. Adverse side effects also non-reported. And flavonoids, they also reduce risk of postmenopausal cardiovascular disorders, and adverse effects are also non-reported. As we see, these non-hormonal options of treatment of menopausal syndrome, they have benefits on the cardiovascular disorders, osteoporosis, cognitive decline. Also, they are beneficial in the treatment of climacteric syndrome. And they are also, they have less adverse side effects than the hormonal replacement therapy. But anyway, these additional methods of treatment, they are not so beneficial as the hormonal replacement therapy. And also, we recommend changes of lifestyle and help women to experience the increasing of estrogens. And what we recommend to do, it's a special diet. It's a product that contain phytoestrogens such as fruits, whole grains, legumes, estrogen promoting nutrients containing vitamin C, A, E, and zinc. We recommend to have regular physical exercises. It's a moderate weight bearing and strength training exercises, and we recommend at least 30 minutes a day during 5 times a week. This is enough, and we recommend mostly swimming or Pilates and just outdoor walking. Healthy habits: monitor caffeine intake and quit smoking and alcohol abuse. We also recommend medication, hormonal replacement therapy, or combined oral contraceptive in the period of menopausal transition, and alternative medicines. It's different herbal supplements containing phytoestrogens and hormonal regulating herbal supplements. The main principles of maintaining a woman's health are: the hormone therapy is a part of an overall strategy for maintaining a healthy lifestyle, including dietary recommendations, physical activity, avoid smoking, restriction of alcohol consumption, resistance to stress, individual selection of preventive and therapeutic measures. The great Coco Chanel said that you can be gorgeous at 30, charming at 40, and irresistible for the rest of your life. And I want to finish my lecture with a quote of Victor Hugo. He said that the 40 is the old age of youth, 50 the youth of old age. Henri Toulouse-Lautrec, Salon on the Moulin Street. And I want to demonstrate you pictures of famous women of advanced age, but they are still very beautiful. Sophie Loren, Audrey Hepburn, Catherine Deneuve, Türkan Şoray, Elizabeth Taylor. Thank you for your attention.